All right, let's keep with Reddit. Extreme pain. Tooth resorption. One of my baby teeth became slightly painful around a week ago. I went to the dentist and she said it was reabsorbing. The plan was to get the hospital to take it out in January when my wisdom tooth is due to come out. However, right now I am in extreme pain and my gum is pretty swollen at the site. Can I wait to see the dentist again, or is this an emergency type of situation? I keep reading online that a reabsorption shouldn't hurt, and from my last experience with my now gone baby tooth, it didn't hurt during the reabsorption. Rather, the tooth just fell apart one day.
So, the reabsorption, or we call it as a resorption or erosion. So, what happens is, like for example, if this is a baby tooth sitting in the gum tissue, and then you have the permanent tooth come through, and it starts eating the baby tooth, and then it literally at some point the baby tooth, if this is like this, it keeps resorbing, and then finally it becomes really tiny. And then when it's become really tiny and there is no root to hold in the bone, and it becomes kind of wiggly, and then the tooth starts to fall out. However, sometime, let's say the permanent tooth is supposed to come through like this.
Right.
Sometimes for a variety of reason, the permanent tooth does not come through properly, or it does not come at the right angle. Now it starts to go in a different angle. So now the tooth does not resorb because the permanent tooth does not hit the baby tooth. So the tooth ends up staying for a variety of reasons. We call them as a retained baby teeth. So you may be an adult, you may still have some baby teeth. And I've seen some people, some adults, like as old as like 80 or 90 years old, they still have some baby teeth. So it's not uncommon to have baby teeth that are retained. So when you have those retained, the challenge is when they completely resorb, then you don't have a problem. But when they don't resorb, when you get an abscess like this or a pus pocket like this, can you leave a pus pocket in your body? Can you leave the tooth without doing any treatment when you're really hurting? So the question will go back to you if you are my patient. So if you're hurting, don't you want to do something about it?
Yeah, I want to get out of pain as soon as possible.
Absolutely. So if you want to get out of pain, and the sounds of it, like the person has some infected gums around the tooth also. First thing is, you don't want to be in pain. So if you want to get out of pain, the challenge is not taking the pain medication. The recommendation is not to take pain medications when you have toothache. You want to address the root cause. You want to address the problem, and you want to address not just the symptoms. You want to address the problem. So if this is an abscess tooth, my recommendation to my patients all the time is to get the bad tooth out. And that way you don't even have to take pain medicine. I personally don't like to take pain medications. I don't want to be taking any type of pain medication if I can get rid of the source of the problem. And so I would not recommend you do that. So get rid of the problem. And the biggest challenge is not the pain medication. So be it, like if you're going to take pain medication a week or 10 days, no big deal. My biggest challenge is the infection. So think about this. When you have a headache, right, for example, the headache is just not going to stop right here. So that's going to make you feel miserable, right? So you may have a headache, and then if you don't take the right medication, then it's going to make your whole body start to feel miserable. Same thing with infection. Whenever you have infection on your teeth, the infection is just not going to stop right here. So I tell my patients all the time, so when you have infection in the mouth, and don't think that it is just teeth. We got enough research and we have enough medicine backup and to show that the infection just does not stop in the mouth. I tell my patients every day, when you have infection in the mouth, the infection is going to get right into your carotid here. From here, it goes into your heart and the kidneys and the lungs and then even to your brain. And you hear in the news, Google, this person died of tooth infection. This person died of a brain infection from a tooth infection. So it is not uncommon for the infection to spread. And I'm not trying to scare you. And I'm trying to tell you what are the possibilities. So my recommendation is, if you have an infection, you don't want to unnecessarily take a risk. And because we can tell you, or we can show you from research, people who have infection, they are at a higher risk of getting a heart attack or a stroke, or have to take multiple medications to control diabetes and multiple other medical conditions. There are like about 50 diseases that are linked to the infection in the mouth. So you don't want to be leaving an infected tooth in the mouth that could be putting you at a risk of multiple other health issues. And this is as simple. Hey, there are so many things that we cannot control in our life to take care of our health, but this is simple. That is completely under your control. All it matters is like going to the dentist, have the baby tooth removed, which is very easily you can control. So focus on things that you could control to take care of your mouth. So then let the other health be under control. Yeah.